Welcome to the Agility Insurance Services Podcast, your inside track to smarter growth, stronger partnerships, and real success in life and health insurance. Your premier FMO partner nationwide.
Welcome to the Agility Podcast. My name is Scott Meeks, AVP for Medicare Sales. And today I have my good buddy and coworker with me, Mike Berglund. Mike, will you introduce yourself?
Hey, Scott. Thank you. I appreciate that. Mike Berglund. I'm the AVP of ACA Sales for Agility. I've been in the business about 20 years. I've always been on the individual side, and I live in Clearwater, Florida.
Nice. Yeah, so I've been in the business about 15 years. I kind of started in final expense and then worked my way into Medicare, and I live in Atlanta. So Mike and I work closely together. Obviously, he's on the ACA side. He's the ACA guru, and I'm on the Medicare side. And so we were talking the other day about just cross-selling strategies and how to get started selling. If you're a Medicare agent, get started selling ACA. And if you're an ACA agent, how to start selling on the Medicare side. And so we thought we'd put together this podcast to kind of start the conversation and kind of roll through best practices and that sort of thing. So, Mike, I'm going to start it off with you and ask you a question. And if you can answer, and I can chime in as needed. So if you're a Medicare broker today and you're not selling ACA, why should you be? Why should you start selling? Why should you care about ACA?
Yeah, that's a great question. A lot of agents out there, they silo themselves. They either go only into ACA or they only go into Medicare, and they concentrate on that and they stay within their lane. You really need to be on both sides. Number one, as you have turning 65s, you have someone going to Medicare, the spouse is often needs coverage also. They'll need an ACA plan. If you don't offer both, you're letting another agent into the house. So most families want to work with one agent. If you can't service or help out that spouse, then you have to call in another agent. Now you've got two agents working within that house, and there's a good chance that other agent could sell both Medicare and ACA.
Yeah, I totally agree with you there. Very important to be able to sell both lines of business. And I kind of expand on that a little bit. So I was reading an article the other day that said, we're at the tail end of the baby boomer generation. So this is the largest population boost in American history. And all of these baby boomers are now turning 65. And so this article was stating that 10,000 people a day are becoming Medicare eligible. I mean, that's astounding when you think about it. 10,000 people every single day are turning 65. And to your point, you hopefully have already sold them an ACA policy, right? You sold them an ACA policy when they were 45 or 50 or 60. And now you want to be seen as that trusted resource and be able to offer other products as well. And Medicare is just that natural transition. And I totally agree with your point too about, not letting another agent in the house. I think when you become that trusted advisor, you're not just a salesperson, you're not just selling one product, but you're servicing that client for their entire lifetime. Whether that be when they're, like I said, 30, 45 years old, up until 65 and even later, maybe even with a final expense product. You want to be able to service that client from day one and for the entire lifetime of the client. So that's a great point.
You made a really good statement about the 10,000 people from the baby boomer generation that are turning 65 every single day. We always hear the median age for an ACA person is 41. But did you know the most common age for someone with an ACA policy is age 64? The next most common age is age 63, and there's quite a few reasons for that. Number one, people become entrepreneurs. They go out on their own. They don't have the group benefit, so they're starting their own business, so they've got to buy an ACA policy. Number two, a lot of us are going to be hitting retirement. We retire at 61, 62, 63, and they need a product that can fill the gap from the age they retire until they hit Medicare. So the most common age for someone that's on an ACA policy is going to be age 64. The next is 63, and the next is 62. So if we're working Medicare, that's our primary source of business. You've got a really good lead source right there of turning 65s if you work that ACA stream.
I didn't even know that. That's crazy. I always envisioned someone being in their 40s or 50s maybe and purchasing an ACA policy. But that's a good point, right? I mean, as we age, we typically have a harder time finding that next career move if we get laid off or something. So,
Hmm.
yeah, that's a good point. I didn't realize that. So you don't have to wait very long at all for that person to turn 65, right? You're saying that
Exactly right.
62, 63, 64 is one of the most common ages. Yeah.
Yep. And
Yeah.
if you look at your referral sources, if you're working Medicare, you're asking people that are age 63, age 64, people are turning 65. If you work both ACA and Medicare, now that opens up any age group. So it's a lot easier to give you a referral to help increase sales, increase business for yourself. And then your Medicare skills, it translates over to ACA. They're very similar. We both work off of looking up medication lists that are requested. We look up providers. We're looking up formularies. It's the same skill set to work with ACA as it is with Medicare. So it's a really easy transition moving from Medicare over to ACA.
Now that brings up a good point. I think a lot of Medicare brokers, maybe if they've only sold Medicare, they might think that transition is pretty hard, but you're saying, hey, you're already doing the same things, right? You're
Hmm.
already looking at the doctors, you're looking at the prescriptions, you're making sure, reviewing the plan details with them, the max out of pockets and the deductibles and the co-pays for your primary care doctor and specialists and things like that, right? Is that kind of
Yep,
what you're getting at?
exactly right. So transitioning into like agent skills, what do you think's the most common thing that a person that sells Medicare, what do you think they're missing?
So if they're selling Medicare today but not selling ACA, or what's the question exactly? I'll make sure I understand.
Just what is a Medicare agent missing like for skills? I would say for an ACA, it's going to be client preparation. There's a really big window over the summer leading up to open enrollment. This is more of a downtime. Agents like to take vacation. This is a time to be in front of the client and start your client preparation. So in August, September, even in July, it's time to reach out, ask them about their income, make sure nothing's changed, and then ask them about upcoming changes for the next year. Are there any movement? Are you going to be moving, changing locations? Do you have kids going to college? Is anyone pregnant? Is there a marriage or divorce? You can also ask what medications you'll need to look up. Are there any new doctors? Do you have any impending medical that's going to be coming up that we need to know about, surgeries? So you can do all your prep work leading up to open enrollment in August, September, check out all and then once the plans get released, you can do your wrap up, but it's going to really cut down on your client time as you're spending time with them because you've already done all the prep work and legwork leading up to those meetings.
Yeah, that's a good point. Yeah, that's a good call out for sure. And I think it's very similar on the Medicare side too, right? So I don't know if you guys have to do this on the ACA side, but on the Medicare side, you have to get that scope of appointment signed before you go and talk to the Medicare beneficiary.
Mhm.
And so a lot of times you can do that digitally, via phone or text message or through one of our enrollment platforms. But having that conversation before you get into the home, and kind of prepping for that meeting, just asking some of those questions to be prepared for before you get in is crucial. It'll make the meeting go so much easier. And also too, if you do pick up ACA, you're traditionally a Medicare broker and you pick up ACA, that would be a great time to ask about who else is in the house, right? So
Absolutely.
you've been talking to the senior, the person that qualifies for Medicare, but oftentimes, they could be possibly married to someone younger or have children living at home, maybe adult children living at home who might need, an ACA coverage or some other policies. And I think if you ask those questions before you go into the home, that can kind of set you up for a big day. You're not getting just that one Medicare policy that you thought. Maybe you can pick up the spouse or the adult child or the children in the home on an ACA policy. So
Absolutely.
yeah, that's a great question.
I get the question a lot. How does a broker talk to a potential client without sounding too salesy? I think the word salesy is what most people are thinking when you're trying to quote unquote sell a policy. It's not sales, it's planning. You're helping them plan, just like someone who's going to be buying car insurance or homeowners insurance. It's a need. And when you go in, let's talk about family protection in cases of emergency, also the expected expenses like going to see a doctor. So you're helping them plan, keep expenses off of them. It's not trying to push a product onto them.
No, that's so true. That's a good point too. I mean, I think as insurance agents, we obviously hopefully got into this for the right reasons, and that's to help people. And it's our job as an insurance agent to just mitigate their risk, whatever that is, health
Mhm.
insurance, life insurance, accident policies. That's our job as insurance agents, is to mitigate that risk. And so the same is true for Medicare. I think just opening those questions up and asking all those open-ended questions to uncover the needs and to find out really what is at risk for the client. Is
Mhm.
it they need additional, maybe a hospital indemnity policy or something like that, just to help mitigate those risks. And I think by doing that too is kind of how our conversation started. Was really not just offering that one product and being seen as that advisor. And I think that gets you out of that salesy mode, to your
I think
point,
so
to use
too.
your word, salesy mode. Hey, we're here to help you, right? We're here as your advisor. We're here to help you with whatever you need, whether that's Medicare or ACA or whether it's an ancillary product. And it's our job to help you identify, uncover those risks that you have in your life, in your lifetime, and offer the right product for you. So,
Yeah.
yeah,
And
yeah, that's a good point.
without sounding salesy, people are always looking for reasons for touch points. Like, I want to call my client in February. I want to call them in June, but I don't know what to talk about. I don't want to try to offer them a dental plan. I don't want to offer them a vision plan. If you have cadence touch points, like right after you sell the product, send them out what you did that day on the product that you put them into. We put them into X carrier. Here's a plan name. But then also, how do they make a binder payment if it's ACA? So give them binder payment instructions. Give them how to look up providers. Give them how to log into the portal, and then set expectations. Generally, you should receive your cards 2 to 3 weeks after. And then at the bottom of the note, say, I'm going to follow up with you in January just to make sure that everything is as expected. You follow back up in January and you say, hey, was the doctor correct on the card? Have you had a chance to use it? Have you set a PCP appointment? Um, did did you set up the reoccurring payment online? So you're more helping them and guiding them. And then another great check-in, middle of the month, everything through ACA is done through income with subsidy. You just call up and make sure, just, hey, checking in. Want to make sure that there's no surprises from the plan that you've experienced, and want to make sure you mention you're making X income. Is that still going to be valid for the rest of the year? If not, let's update it so you don't have any surprises at tax time. So it's just, as long as you have cadence check-ins and set those expectations prior, you can always lead in with other products at that point to increase income, but your clients will be expecting those cadence check-ins.
Yeah, that's funny you should say that. We kind of started off the conversation about how those skills translate from ACA to Medicare and Medicare to
Mm-hmm.
ACA. And that's a great best practice for Medicare agents to follow too, right? Is once you enroll that member, call and make sure they receive their ID card, call and make sure they went to see their primary care doctor for a checkup. And then,
Absolutely.
through those regular checkups throughout the year, that's how you become seen as a trusted advisor and not just a salesperson or a salesy, have that salesy pitch. You're there to help the client for the entire year. And that's
Mm-hmm.
that's a good point. That's how you uncover other products. That's how you uncover the need, is being trusted and having those regular touch points. And that's going to lead to a lot of things, right? Obviously, persistency, that's going to help keep those clients stickier, help keep them on the books longer. But this is also going to open up a referral source for you. I think when clients start realizing that you care about the client and not just the sell, they're going to start referring clients to you as well. So yeah, you brought up some good points there, and I think that's a good best practice. In any line of business, whether whether you're in insurance or not, whatever you're selling, I think just regular check-ins with a client can go a long way. Absolutely.
Absolutely.
So
Do you
my
have any
guy,
top tips for 2026? What are you seeing out there in Medicare?
yeah. So top tips. I think the last few years in Medicare, it's been a little crazy, right? We've seen some plans exit counties. We've seen some hospital systems, have some contentious contract negotiation with different carriers. And so I think really for me, I would say be prepared. Be prepared by offering multiple plans, right? Don't just pick one or two or three Medicare Advantage plans. Make sure you have multiple Medicare Advantage plans. And after this conversation, I'd say a top tip is not just to offer Medicare, right? Have ACA as
Absolutely.
well, and other lines of products. Your hospital indemnity and your life insurance and things like that. So you can you can meet the client's needs where they are. Medicare Advantage isn't a fit for everybody. And so just being able to offer multiple lines there, I think will go a long way. What about you? What about top tips for ACA?
The big change this past year was they got rid of the subsidy repayment cap. So if you have your income is too low and you receive too much subsidy, last year there were caps in place. You only repaid a portion of it. That went away for 2026. So it's check in with clients. Make sure that their income is tracking along with what's on the application. Document it. And every time you talk to a client about their income, send them a follow-up email. Say, hey, we just spoke. We're going to be changing your income. We're leaving it the same. We're leaving it X. So cover yourself, so you have everything documented, because when they file taxes in 2027 for 2026, and there's a big income discrepancy, make sure everybody's covered, that you have all of that documented. So top tip would just stay on top of income for all of your clients for 2026.
Yeah, that's something that we typically don't have to deal with on the Medicare side, right? So that will be a little bit of a learning curve for someone who's just selling Medicare and coming to ACA. I think we're doing the regular check-ins. To your point earlier, we're checking the physicians and make sure all the doctors are in network. We're checking their drugs. We're checking the formulary, but we don't have to check income typically.
Correct.
unless they might qualify for a Medicaid or a special needs plan. So that's one thing that I think those coming from Medicare selling ACA will have to remember during the regular checkups. But really, besides that, I mean, to your point, it's a lot of the same, right? It's a lot of the same.
It gives you a chance to talk to your clients. It gives you a
That's
chance
right.
to call in and see what's going on and get referrals and look at other products, and you're doing them a favor by checking in.
Yeah, that's a good point. So, I don't know a lot about ACA and how to get certified and how to begin selling ACA. Mike, how does someone go about getting the ball rolling? How do they start selling ACA?
So they want to check out what state they're in. If they're there's two different types of states. One's a state-based marketplace. One's a federal facilitated marketplace. Similar to AHIP on Medicare, we have certifications as well. If you're in a state-based exchange, and you're licensed to sell in that state, you do have to go through that certification process for each one of those states. If it's federal facilitated, means it is a federal exchange. Many of the states are under that as well, and all of those states are under one process. So you can get certified through either the federal facilitated marketplace, or on the states you sell in.
Gotcha. Okay. Yeah, it's very similar on the Medicare side in that there are carrier certifications. And so I would say, if you're an ACA agent, I have a hard time saying that. That's a lot of A's there in a row. ACA agent selling just ACA today, and you want to begin with Medicare. For us, I think the first step is getting contracted. You can contact me. I can help you get those contracts. If you use my admin and you're an agency and you have an agency set up under my admin, you can request contracts for Medicare, or you can go to enrollinsurance.com and request the contracts. And then from there, you will take the AHIP certification, which is one certification that covers all carriers. And then you'll do the individual carrier certification. So the AHIP certification is a little bit longer, maybe takes a few hours. First time you do it, it's, a little tough, a little cumbersome, but the more you do it, the easier it becomes every year. It's pretty much the same questions. It feels like every year for as long as I've been doing this, So just to recap on how to get started on the Medicare side, get contracted, go to enrollinsurance.com, request the contracts, and then jump in with your AHIP certification, and then do the individual carrier certification. And if you reach out to me, you have questions about which carriers you should represent in your area, I'll be glad to help guide you and point you in the right direction of what's, kind of a hot product this year and get you started, as well as, we can offer some training, right, Mike? I mean, if someone's new to ACA, we can offer the training and help them along the way.
Absolutely. And we have trainings that are on demand. They're downloadable. That's on our website that we've done. And they can also join our live trainings. We're doing trainings every week, both on Medicare, our ancillary products, and also on ACA. So there's abundance of trainings through Agility, and just go to enrollinsurance.com to find those.
Yeah, awesome. Yeah, same thing here. Tons of Medicare trainings every week. And then look, I mean, we try to, I feel like, what we do better as an FMO, better than most, is try to meet you where you are, right? So if you are an ACA agent and you have no clue what's going on the Medicare side, just reach out. Just reach out. Just ping us, call us, email us, and we can set up a customized training just for your for your situation, whether that's 2 or 3 agents or 50 agents. We can do a live training or a virtual training for you, and just kind of help you get started. So. Well, look, man, I think we covered all the bases here. We've been talking for 25 minutes. I can't believe it's gone by so fast. Uh, Appreciate you joining today.
Absolutely.
I feel like it's been a great
Been fun
conversation.
being on.
Yeah, absolutely. We'll do this again. We'll have to do this again for sure.
Yep, absolutely. I'll catch you next time. Thanks, Scott.
Yeah. Thanks, Mike. Talk to you soon, man. Appreciate it.